ANS 3.0 summit, which is also very importantly the annual nephrology summit. And to talk more about this event, we're joined by Dr. Dinesh Khullar, who is also the chairman of nephrology and renal transplant medicine, Max Hospital, Saket. Sir, thank you so much for speaking to me.
Thank you very much. As you have said, it's a very special day for us today. We are holding the third edition of Annual Nephrology Summit, which we at Max Hospital Saket, in collaboration with Dr. Reddy's lab, started the initiative about 3 years ago. And this was basically done keeping in mind the great progress which has happened in the field of nephrology the world over. And all these years we had realized that the chronic kidney disease, as a result of the lifestyle diseases, especially diabetes, high blood pressure, or a few of the glomerular diseases like IgA nephropathy, had really become a menace. It was affecting a large population across the world, and India was no exception. But unfortunately, till about a decade ago, we did not have too many drugs which could really take care of the menace. And suddenly, there have been a spurt of new medicines, very promising medicines, which have come our way in the last 10 years or so. So obviously, it is the need of the hour to know more and more about these diseases so as to be able to help the patients suffering from these very common diseases. Gone are the days when we would say, yes, we know our patients that we know that you have a disease, but unfortunately, we can't do much about it. Not any longer. There was a time when a typical chronic kidney disease would begin, and within a matter of 1 to 2 years, will totally destroy the kidney function. Not any longer. We now have drugs which have been able to prolong the chronic kidney disease and the total loss of the kidney function by as much as 10 to 15 to 20 years. I'm not saying we are able to reverse a disease which is irreversible, but we have made a huge difference from something like 1 or 2 years to something like 10 to 20 years. Eventually, yes, if the disease is progressive, they may land up in a stage requiring dialysis or transplantation. But again, there is so much of hope for people requiring dialysis. The quality of dialysis has so well improved, and it's a matter of pride for us in India that Indian nephrologists are now able to offer dialysis services which are at par with the best of the standards across the world, better than many of the developed countries as well. That's a matter of huge pride. And when it comes to the other form of permanent cure for patients dealing with chronic kidney disease, that is transplantation. Well, a lot has happened. Our results across the country have vastly improved. From a very poor survival rate till about a few decades ago, now we can match up with the best anywhere in the world. A very, very long result. People have survived after a successful transplantation for a period as long as 30 to 40 years as well. But all this required that we as nephrology community came together and learn from each other, and also remain up to date with whatever is happening in the contemporary world of nephrology. So I personally strongly believe that the meetings like these, the conferences like these, give us the required platform to be able to interact with each other, to listen to each other, devise strategies, adapt the whatever is there in the literature to the Indian conditions, to try and make the treatment as cost effective, which is certainly need of the hour. But before that, we need to, as I said earlier, update ourselves with the contemporary knowledge. And you'll be glad to know that it's generally believed that the Indian nephrology treatment, as well as the care provided by the nephrologist, is definitely matching up with the world standards. So over the last 1.5 days, and this is the second day today, we've had a great interaction amongst the leading nephrologists from all parts of the country who took time out to be here with us. And it's a large gathering, as you can see inside the hall. We have discussed about the various aspects, and we have learned from each other. There was discussions on diabetes affecting the kidneys, the IgA nephropathy affecting the kidneys, the newer concepts about complement mediated diseases, newer drugs like eculizumab, which are now available in our country as well. But certainly, going by the need of the hour, targeting the diabetic kidney disease, talking about the how to enhance the transplantation rates, because even when we know about 200,000 new people require kidney transplant in our country, the problem has been as to where will the organs come from. Now we are wanting to expand the pool. So we had a great discussion as to how to overcome the dearth of the organs via the paired kidney. It was a wonderful session on how to bring in many families whereby they were not able to accept kidneys from their own donors. But when we put them in a pool, it was then possible to expand the pool and go ahead with transplantation. Another thing which has unfortunately not really become popularized in our country is the kidneys from the deceased donors. We do know that a deceased donor who's brain dead before he finally dies can give life to so many people wanting the organs. Unfortunately, this has not been happening in the right way. We have to learn. There are few parts of the country which have done better. So we are learning from them. We are wanting to have some common policies, which certainly we are better off than where we were till about a decade ago, but long way to go. So these are the key areas, few lacunae, where we have to rise to the occasion to be able to meet up with the demands and expectations of our patients. And certainly something which we hold very close to our heart is to impart the top quality care to our patients suffering from various kidney diseases.
Thank you, Dr. Dinesh. I think you covered all the points, all the questions that I wanted to ask you. But I have one last question. What major change have you, because this is the third year, what major change have you incorporated in yesterday's summit that is also going today, this year's summit?
That's a very pertinent question. So every year we have wanted to live up to the expectations of those attending the meeting. We have to keep ourselves up to date, and the kind of progress which is taking place across the world, we have to imbibe. So every year it is different. This time there were new topics. There was a lot of new research has taken place, and every day we are encountering some great exciting research which takes place. So meetings like this on an annual basis are the ones which allow us to take stock of the situation, and this meeting is no different. We have addressed those issues where we finished in the last two editions, believing, hoping that we will get the answers to. Yes, we have got the answers to some of the questions which remained unanswered in the previous two editions. So this one is even better.
Thank you so much, Dr. Dinesh, for speaking to us. So yes, viewers, we spoke to Dr. Dinesh Khullar, who spoke about the event in vast, and to our viewers also who are watching us on television. The summits like these, events like this are definitely the need of the hour, are an eye opener, especially for our viewers, everyone, to be informed, to be educated about everything that is going on, and also how India is evolving. You talk about nephrology, Indian nephrology rather, or the Indian healthcare system. This is my report. This is me, Brian Anthony Thomas, signing off with camera person Ankush for NewsX Delhi.